So here I was starting third year, and all I could honestly think was, what in the world is a community health nurse? I mean, I just survived second year. I didn't think third year could be worse. I was looking at the syllabus thinking, so many pointless things to do. But in fact, they're really not pointless, if only I knew. You see, so far, we've been taught to use downstream thinking. Remember that picture they showed us with those people sinking? See, they are downstream thinkers, simply pulling people out after they're down. But upstream thinkers, they try to help people with the cause so they don't get a chance to drown. I learned community health nursing likes to focus more on the upstream. They don't work for clients, instead they include them to become a team. Fairness is the objective. Equality is not just, but equity is effective. Now, pause. What does that even mean? Let me bring up this picture that I'm sure we've all seen. It shows you that equality is treating everyone equally, regardless of their personal benefits. Equity is giving everyone what they need for success. It eliminates the deficits. When you focus on equity, a beautiful thing takes place. The playing field is leveled regardless of age, status, gender, or race. Establishing equity in the community creates fairness. It takes a holistic approach and increases awareness. I realized that both social economic status and social determinants of health influence choices. It's not random that hospitals can become homes for those with no voices. I saw that those in the lower class have less supports, but hardly anyone takes that into consideration. You certainly won't find them in police reports. Now I know that prevention is the key. If people had the resources to make different choices, they would be in a different predicament. Don't you agree? Community nurses go after equity and help people with what they need. They provide them with the means to succeed. It's no longer about the immediate effects of my care to one human. It's about the long-lasting effects of my advocating that sends a community booming. Community health nurses use downstream approaches as well, such as harm reduction plans. Places like safe injection sites work way better than zero-tolerance bans. Community health nursing is about taking things with a grain of salt, always advocating, trying to make a large impact, but receiving little praise as a default. It takes a special kind of person to do this every day. Burnout is high, but I realized after you see the impact you've made, it's worth the stay. So, what in the world is a community health nurse really? Simply put, they're an advocate, an educator, and basically everything else in between so that those with little say can live freely. So that is the end of my presentation. Thank you all so much for your time. And if you're still lost on what community health nurses do, I hope you figure it out before this year's through. Good luck.
Created using Powtoon.